Hello and welcome once again to this channel, Clinic Wahala, by yours truly, Dr. Catch. Okay, we'll continue our series on the lessons we've learned in the past 1 month seeing diabetic patients. So on today's episode, do you know that a history of recurrent infection, especially for our sisters, the ladies, the women, history of recurrent infections can be a pointer to diabetes. Generally, that is a pointer to immunosuppression. What it means is that when your immune system is weak, any small infection that passes around, any small organism or bacteria that goes around, whereas other people will fight it and throw it away, it may enter a diabetic and will be difficult to treat. You will notice that sometimes some of these people, when they treat infection, it comes back again. They treat in a few days or a few weeks, they're talking about infection all over again. So the history or the story of recurrent infections can be a pointer to immunosuppression, reduced immunity, and diabetes is one cause of reduced immunity in our environment. It's a common cause, so you need to be aware of that. Then, if you're a diabetic, I take God beg you, be careful how you sustain injuries. You cannot be living a daredevil life when you are diabetic. Others will be playing rough play. You follow them and play rough play. One of the reasons you see these people that are amputated, that lose their legs because of diabetic foot ulcer, some of them is because of all these small wounds they get. Very innocent wound though, just small wound. Because diabetes has a way of attacking the nerves, affecting the nerves of the body, especially the legs and hands. Somebody with diabetic may march on a nail, bottle, or pin and doesn't even know that it pierced him, only for him to later see blood, and he will go ahead not treating himself or not getting to a hospital for them to diagnose him and take care of that. He will be using all what not to treat that wound. Before you know it, small wound will keep expanding. You'll be treating is expanding because it's not an ordinary wound, it's a diabetic wound, and you need to treat it aggressively. A medical person, a doctor, should be able to treat that aggressively to prevent that from increasing and going forward though, and causing something that you did not prepare or imagine. Many young men and women have lost their legs from diabetic foot ulcers. They have an ulcer, they have a wound, they mismanage it, it keeps increasing. Before you know it, it gets through the tissues, to the skin, through the skin, to the muscles, to the bone, and it becomes difficult to handle. Next thing, we are saying amputation. So just know that poor wound healing, wound where they heal easily, and frequent infection you treat, it will come back, can be a pointer to diabetes. That may be a call for you to go and check and be sure that your sugar level is fine. I'm not saying diabetes is the only cause of reduced immunity, but it's a common cause in our environment, so you need to check it. Poor wound healing, recurrent infections may be a pointer to diabetes, so be careful and be vigilant. This is still Dr. Catch, Clinic Wahala. Do well to like, share and subscribe. Thank you very much.